Today's topic is dyslexia. Dyslexia is a common learning disorder that affects a person's ability to read, write, and spell. According to the International Dyslexia Association, dyslexia is marked by difficulties with accurate and/or fluent word recognition and by poor spelling and decoding abilities. This may be due to problems identifying speech sounds and learning how they relate to letters and words. These problems are first identified at school. Dyslexia occurs in all areas of the world. Dyslexia affects the part of the brain responsible for language processing. However, people with the disorder have normal vision and usually have normal intelligence. People with dyslexia are just as smart as their colleagues. Dyslexia is a lifelong condition and is the most common learning disability. The effects of dyslexia vary from person to person, and it can lead to a number of problems, including trouble learning and social problems, such as low self-esteem, behavioral problems, anxiety, and withdrawal. There exist three main types of dyslexia: primary, secondary, and trauma dyslexia. Primary dyslexia is the most common form and is passed along family lines through genes. This type of dyslexia does not change with age. Secondary or developmental dyslexia is caused by problems with brain development during the early stages of pregnancy. This may cause impaired neurological abilities in word recognition and spelling. This type diminishes as the child matures. Trauma dyslexia usually results from an injury to the area of the brain that controls reading and writing. Causes: dyslexia is believed to be caused by both environmental and genetic factors. It is linked to a certain gene that affects how the brain processes reading and language. Some cases run in the family. It may begin in adulthood as a result of a traumatic brain injury, dementia, or stroke. Symptoms: dyslexia symptoms may be displayed at any age, but they normally present in children. Symptoms may be hard to recognize before a child enters school, but there may be some early clues that may indicate a problem. This may include learning new words slowly, taking longer to learn how to speak, finding rhyming challenging, inability to distinguish between different word sounds, such as reversing sounds in words or confusing words that sound alike. The symptoms may become apparent once the child is in school and may include difficulty spelling, avoiding activities that involve reading, spending a long time to complete reading or writing related tasks, reading below the expected level for age, difficulty copying from a book or a board, difficulty remembering or understanding what he or she hears, inability to pronounce unfamiliar words, difficulty finding the actual words to express thoughts. Dyslexia symptoms in teens and adults may be similar to those in children. Other symptoms may include difficulties with summarizing stories, difficulty memorizing, difficulty reading aloud, difficulty learning a foreign language, trouble understanding idioms. Diagnosis and treatment: dyslexia is a difficult disorder to diagnose. There are many factors that the healthcare practitioner reviews to diagnose the disorder. This may include family history and early development, home life, questionnaires to identify reading and language abilities, neurological tests to see if there is another condition that may be causing or adding to the problem, psychological testing, oral language skills. Treatment: early diagnosis and intervention are important. Children who get extra help early may improve their reading skills enough to succeed in school. Children who don't get help early may have more difficulties learning the skills needed to read. Specific educational techniques are required in treating dyslexia. Psychological testing will help the teacher develop a better targeted program for your child. Teachers may use techniques that involve hearing, touching, and vision to improve reading skills. Guidance and support can help minimize any impact on self-esteem. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.